One day, you go to bed with a diabetes index of 110, but when you wake up the next morning it has skyrocketed to 150. You are extremely worried about whether your diabetes is getting worse? This article will help you better understand why your diabetes index goes up suddenly while you are eating nothing at night. And early morning hyperglycemia usually occurs in diabetics. It also needs to be controlled immediately. Morning hyperglycemia is the term for blood sugar that exceeds normal levels in the morning when you wake up. Both people with diabetes and normal people can experience this condition. With diabetes, blood sugar can rise at any time of day, but high blood sugar every morning after waking up is a problem. Immediately apply the following 2 simple steps to reduce blood sugar. Avoid morning high blood sugar. Step 1. Find the cause of your morning hyperglycemia. Hyperglycemia is defined as fasting blood sugar, measured in the morning, after a fast at least 8 hours, higher than 130 mg per deciliter, 7.0 mmol/L. This may be a natural phenomenon due to a normal circadian rhythm, which is self-corrected by the body, causing no significant symptoms. But for people with diabetes, the body cannot self-regulate, so the high blood sugar is prolonged, and manifestations such as dizziness, dry mouth, thirst, frequent urination, blurred vision, fatigue. Not every morning high blood sugar has one cause. It could be the morning hyperglycemia, the Somogyi effect, or the injections stopped working too soon. Each cause has a different treatment. So, you need to find out why your blood sugar spikes every time you wake up, before you start dealing with them. There will be 3 cases. The first, dawn phenomenon, blood sugar before bed and 2 to 3 a.m. are normal but high when waking up. The dawn phenomenon is defined as the morning high blood sugar level, which occurs due to an increase in the body's natural hormones. Specifically, from midnight to 3 a.m., the time when you sleep best, the insulin levels will be very low because the pancreas does not release insulin. Then around 3 to 8 a.m., the body begins to release sugar glucose, stored in the liver, into the bloodstream along with other hormones, growth hormone, cortisol and glucagon, to prepare for the new day. These hormones decrease the body's sensitivity to insulin, along with low levels of available insulin in the blood, causing blood sugar to spike dramatically. Healthy people can cope with this condition by secreting more insulin to regulate blood glucose levels. But people with diabetes cannot do this, and the inevitable result is that blood sugar is too high. Rising blood sugar caused by dawn phenomenon is often treated with drugs that lower blood sugar. If you are on insulin, this can be corrected by adjusting the insulin levels. The second, Somogyi effect, blood sugar before bed and 2 to 3 a.m. are normal but high when waking up. The second most common cause of dawn is the Somogyi effect, also known as the reactive hyperglycemia. This effect is named after the doctor who first wrote about it. Somogyi effects are common in people with diabetes who do not control blood sugar well because they eat insufficient starch sources, drink too much alcohol, or insulin overdose, so the patient's blood sugar drops during sleep. The body copes with this by increasing the secretion of a hormone that has the opposite effect on insulin, which increases blood sugar, typically a glucagon, which inadvertently causes blood sugar to rise too high. Another cause that may be related to this condition is that the patient does not take an insufficient dose of hypoglycemic drug before bed, so their waking up blood sugar increases. Hyperglycemia caused by the Somogyi effect is not always obvious. However, morning sweats and headaches can be a warning sign. If affected by Somogyi effects, patients should have a snack before bed or ask their doctor to adjust the dose of insulin for night use. The third, waning insulin, blood sugar is high at 2 to 3 a.m. and higher than when waking up. If you are treating diabetes with insulin and experience a spike in blood sugar in the morning, it may simply be that insulin expires too soon. Changing the dose or timing of insulin injections helps prevent this. Step 2. Treat high blood sugar in the morning. Determining the exact cause of hyperglycemia in the morning makes treatment more effective. All you need to do is check and record your pre-bed blood sugar reading at 3 a.m. and waking up for several consecutive nights. The cause is determined to prevent morning hyperglycemia as follows. Dawn phenomenon treatment. Eat dinner earlier and don't eat starchy foods before bed. Go for a walk after dinner. Breakfast on time. Take the pill at bedtime instead of right after dinner. Ask your doctor about dosage adjustments for insulin or other diabetes medications. Use an automatic L-insulin pump. Somogi effect treatment. Have a protein and starchy snack before bed. Adjust medication time. Reduce the dose of drugs to lower blood sugar at night. Change the type of L-insulin. Insulin injections lose their effectiveness early. Increase the dose of insulin injections. Use an automatic L-insulin pump. Change injection time or drug type. Any change in medication requires an appointment from a doctor. Do not hesitate to discuss with your doctor for the best adjustment, both avoiding morning hyperglycemia and ensuring a stable blood sugar during the day. Diabetes index control is extremely important. In addition to using the right medication at the right dose and time, a healthy diet and a healthy lifestyle will help you control your diabetes better. Wishing you good health and always stay optimistic about illness.